We're back on Born B-464 with Dr. James E. Butler, and we're on location in his offices in Columbus, Ohio. And, you know, we did all of this wonderful technology, and you printed my plan out. What's next?
Well, what's next is you're going to show this to Bill and get him to drive you over here.
Drive me over here?
Yeah.
Easy.
Now, here's the thing, is that we have some difficult things that we have to do sometimes, and we have wonderful specialists that help us with that.
Okay.
And we couldn't do without them. Okay?
Right, right.
But the thing we're going to do for you, and the beauty of the average person on the average day, is that with simplified implantology in your general dental office, like we perform here, we can solve this problem without you having to go to a specialty office or an outpatient surgical center.
That's great. I like that.
We can do it right here in the office. We don't need anesthesia, and we don't need that risk. We're going to have you take a pill or two and as pre-medication pills. Okay. We're going to use, in your case, we're going to use something called triazolam, which is basically a very short-acting relaxing agent. Okay.
All right.
And
I've done that before, I think.
Yeah, you're going to take that about an hour before, and then you'll
It makes you happy, happy.
Yeah. And then we're going to take you to a regular dental operatory that's set up for this.
Right.
And then we're going to have you breathe a little happy air.
Right.
We'll have the gums numb.
Right.
And then we'll do the procedure, which will be less than 30 minutes.
Right.
Okay.
Okay.
And at the end of that time, you may or may not have a stitch or two.
Okay.
Typically, there's no swelling.
There's no swelling?
Typically.
Typically
no bruising.
Right.
For this simplified implant procedure.
Right. What if there was for some reason?
Well, we would control it. There's arnica gel for bruising.
Yeah, and can you put
ice?
Right.
You know,
I usually use peas.
We can give you a mild steroid pill.
Okay.
To control that. You'll have all that stuff with you when you go home.
Okay.
And if you do experience a complication, we'll handle it.
Okay. That's fine.
They're very minor in this stuff.
Okay.
The planning process is what makes it happen.
Right.
Okay, because we know exactly where we're going. We're using safe technologies and safe methods. Okay.
Now let me ask you this question: you make the little porcelain cap to go on it, then or before?
We won't make it then. Okay.
What do you do first?
Well, we're gonna put a plastic version on.
Plastic version.
Okay, and that's for two reasons.
Okay.
First of all, we want to recolor this whole corner so it matches your front teeth.
Oh, good.
So we're going to do that. All right.
Same day?
Same day.
Okay.
We'll take this porcelain off and make an imprint for new, and then we'll have 3 perfect teeth in the plastic version. Okay.
Oh.
With people who have TMD problems, TMJ and temporomandibular disorders, what dentists say, it's important for us to establish what bite is going to feel best, because it's been a long time since you had a full molar.
That's true.
And it's going to have an effect on your jaw joint, all right? So we're going to work with that for a little while, and that's a softer version, so it's easier for you to get comfortable and make sure the bite's going to work, all right?
Okay.
So then we see in 2 weeks, we make adjustments,
right.
And then we capture the images that we're going to use to make the porcelain.
Right.
And then at that time, we'll schedule you for the day that we're going to put everything in, okay? Now, at that 2-week visit, since we're going to do the Botox TMD treatment,
right.
It takes 2 weeks for that to take effect.
2 weeks for the Botox to take effect?
That's correct, okay?
Why?
Well, because it takes a long time for it to soak and distribute into the muscle between the nerve fibers and the muscle.
Okay.
It competes with the chemical that causes your muscles to be hyperactive. And so it reduces that.
Now I'm going to be able to smile and everything, right?
Oh, yeah, absolutely. Yeah.
Right.
You'll have all 3 teeth, and you should be functioning pretty normally.
Okay.
But during that window, we're going to make sure that we don't have a negative effect on your bite, because sometimes hitting harder will have an effect on your jaw joint, so we need to adjust those.
Do I still need to wear the plate then?
We're going to adjust the plate. You're going to bring it with you. Okay?
I have it with me.
Once the Botox takes effect, though, many people can get rid of the bite split.
Really?
Yep.
That would be so nice not to have to wear that anymore. I mean, you know, I'm so used to it now that But I may look different.
Probably not.
Oh, okay.
But if you want to invest in more Botox.
Yeah, right. I can't. Or if I would have put more of that stuff in my thing, then I won't have that, right?
Yeah.
I just don't you know, even though she's gone,
Well,
I don't want to look like Joan Rivers.
No, bless her heart.
Bless her heart. She was so good.
But I'll tell you what, this is a perfect storm of dual treatment. You know, dual treatment. What we're going to do is we're going to shut off your TMJ problems, and we're going to enhance your bite, and we're going to enhance your cosmetics in one fell swoop.
That's great.
Yep.
That is absolutely.
Yep.
You know, there's so
And,
many people that have TMJ, Dr. Butler.
Right.
I can't believe it, and some of them don't even realize they have it.
Well, that's true. They just notice they're uncomfortable. They notice they don't chew right.
Right.
They might notice noises, but if you have any of those things, you should discuss that with your.
I mean,
with your
when I open my jaw, you can hear like the crunch city, you know, because, and tell us really, and there's a lot of people that don't know what TMJ is. Would you mind giving a little bit of, you know, telling them exactly what it is?
Well, most of the public was educated on TMJ, which is the name of the jaw joint, the temporomandibular joint. Dentists discuss TMD, which is temporomandibular dysfunction or facial pain syndrome. There's a number of different references depending on what's involved. However, anyone who has uncomfortable chewing, locking, clicking, popping in the jaw joints, pain at night or in the morning, or notice that they clench or grind their teeth, those things aren't normal findings, and it's not age related. Those are damage to your system. I have 9-year-olds that don't have sounds in their joints, but they were fortunate. They didn't have dental problems, their teeth were lined up, they didn't grind their teeth. So your jaw joint doesn't wear out with age. It wears out with overuse and muscular hyperactivity and bad bites.
Really?
So those are the things that we want to track down and we want to solve, okay?
Right, because I've had it since I was age 40. And because I was in an accident and a couple of other things happened, so even earlier than that. So I think that over the years that just, and then somebody broke my jaw, so that happened. So you have all those different things. So, and I've noticed a few times where the jaw will lock.
Yes.
Why does it do that?
Well, there's a piece of cartilage between the two bones, and when the muscles or the ligaments get out of whack, that thing can go in there and get in front of your joint just like a doorstop in front of a door, and it just stops the movement of the door.
Yeah, because it took a little while for me to get the...
And a muscle spasm usually follows, and until the muscle spasm relieves, you can't get back into your joint.
So dentistry has come a long way, hasn't it?
Absolutely.
The last year or so. I mean, it's amazing. From the last time I was here, I mean, the ease of that X-ray machine, absolutely awesome. I loved it. It didn't hurt at all. It took seconds, like you said, to get that X-ray up.
Right.
And so, on that note, we need to take a short break, and we'll be right back with Dr. James E. Butler and his wonderful dental practice and everything about dentistry that you wanted to know. We'll be right back.
Done.